Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Judith Sears-Poisson, and I'll be your host today. Our webinar is on recognizing the diversity of fathers and families in child and family services. And we have four great presenters who will share their research on and experience with strategies to effectively serve Black fathers and Latino fathers in father-specific services, and also alongside mothers in services for children and families. Just to give you a sense of how our hour will be organized, first off, we'll hear from Dr. Tova Walsh, who's an assistant professor in the Sandra Rosenbaum School of Social Work at the University of Wisconsin-Madison. She's also an IRP affiliate. Next, we'll hear from Mr. Daryl Davidson. He's the Community Engagement Director for the City of Milwaukee and Director of the Milwaukee Fatherhood Initiative. Then we'll hear from Dr. Alvin Thomas, who's an assistant professor in the Department of Human Development and Family Studies at the School of Human Ecology at the University of Wisconsin-Madison, also an IRP affiliate. And then our last speaker will be Dr. Christina Moger-Wilson. She's a professor in the School of Social Work at the University of Connecticut and is also a faculty member in the Puerto Rican and Latino Studies project. So thank you all for being here, our attendees and our panelists. This webinar is co-produced with the Wisconsin Child Abuse and Neglect Prevention Board. I also want to acknowledge the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for their partial support of this webinar series through their funding of IRP as the National Research Center on Poverty and Economic Mobility. So we have an hour today, and after we hear from each of our presenters, we'll spend the last 10 minutes or so at the end for a live Q&A. You can type questions in through the Q&A box, and we did get quite a few questions submitted as people registered, so we'll also be queuing up some of those as well. I hope you'll feel free to participate through the chat as well. We love to hear from you through that. And I want to let you know that we do have closed captions enabled, so you can toggle those on and off at the bottom of your screen. We'll be posting the slides and the recording of the webinar within a day or so, and because you registered, you'll receive a link to those by email. So with that, thank you all again for being here, and we'll get started with Professor Walsh.
Thanks so much, Judith, and thanks to IRP and the Prevention Board for hosting another webinar in our series on fatherhood. So I'm really excited to be joined by three fabulous co-presenters and to get to spend the next hour with you. I will kind of skip over this slide. Judith outlined for you just a few key takeaways about where we're headed in this next hour together. And so what I want to start by doing is just framing our conversation a little bit. We've had earlier webinars in this series where we talked in more depth about the many contributions and unique contributions that fathers make to children's development. But as we move into thinking about recognizing the diversity of fathers in child and family services and how we can engage fathers, I want to just start us off by reminding us why this is so important, and that is because fathers play such a crucial role in the lives of their children and families. And so broadly, we can just summarize a whole, really extensive body of literature by saying that positive father involvement is associated with positive developmental outcomes for children really across the lifespan and in many domains. And so that is one of the things that really motivates those of us who are presenting today in the work that we do and in thinking about how we can better support fathers and families. So not only do fathers play a critical role within their families, but fathers' participation in services for children and families also has really important effects for children and families. So across a number of different areas of services, so including permanency planning and parenting training, Head Start in schools, also research on fathers' involvement in prenatal care and in pediatric care, we see improved child outcomes when fathers are involved alongside mothers and children in services for families. And so that really kind of grounds our focus today in thinking about how we can support fathers' engagement and recognizing that different fathers are going to have different needs and be coming from different community and cultural contexts. And so thinking about what different fathers might be looking for and might be responsive to, what barriers different fathers might face, is kind of where we're headed in this next hour. So a few things that I want to say about recognizing the diversity of fathers and families and child and family services is first just to start by acknowledging that our cultural values and beliefs shape how we parent. And so it's, I think, a really important thing for all of us in our own parenting, but also for those of us who work with parents and with families to think about what shapes our own beliefs and the backgrounds that we bring, the assumptions that we have, and norms that we grew up with around what parenting looks like, about what parenting by mothers and fathers looks like. To have our own kind of self-awareness about the beliefs that we bring, and then also to be attentive to learning about and taking the time to understand and appreciate the different values and beliefs, cultural values and beliefs that shape the perspectives of fathers who we might work with in services. And so I want to recognize that norms and expectations for fathers vary both within and across communities. So we'll talk about some of the ways that in specific cultural contexts, there might be particular norms, but also recognizing that within groups, there are lots of differences in terms of how people want to parent, what they were raised to expect in terms of what the role of a father might be. As well as acknowledging that within and across communities, there are often stereotypes or biases held about fathers and fatherhood and father engagement. So those might vary across communities, but also within communities, the ways that people think about, fathers' capacity to parent, whether fathers are meant to be providers or protectors or both, just how expansive we are in thinking about the role of a parent, the role of a father as a parent, and what that can encompass, what's expected of mothers versus fathers, and how that differs or doesn't differ, or openness to, to thinking differently about fatherhood and what it might look like. So as, kind of a first and foundational principle, I think just a critical thing to do is to get to know the fathers you're serving. So get to know fathers in the context of their communities and their cultures, get to know individual fathers and what their circumstances look like and the goals that they have for themselves, whether it's wanting to parent in ways like they were raised, whether it's wanting to do things differently, but understanding, what fathers are looking for and hoping for in their own parenting. In one of our earlier webinars, we talked about some of the barriers to father engagement and services, and I want to just revisit this and emphasize thinking about how some of these barriers can also be connected to thinking about the diversity of fathers and families. So when we think about beliefs that we might hold around what a father-child relationship means, whether it's a primary relationship, a secondary relationship, whether we think about fathers' participation in services as essential or as optional, and keeping in mind that norms are going to vary within cultural groups, within communities, within families about what expectations are for fathers. But when we hold these beliefs that fathers are not essential or that their participation is secondary, that can become a self-fulfilling prophecy. So thinking about, as providers, how we can disrupt those beliefs in ourselves, challenge those beliefs if we're hearing them from families that we're working with, and really reinforce the contributions that fathers make and how important and necessary their participation is, not only in their children's lives, but in services, that fathers bring a unique perspective. If I'm a home visitor working with a family, I'm going to hear some things from mothers and some things from fathers if a child is being raised by a mother and a father, because they each have a unique relationship with that child and engage differently and see different things. And the more I can get information from both parents about what they're seeing, what they're worried about, what they're proud of, what they're, what they want to celebrate in terms of their relationship with their child, that's going to give me a more holistic picture to be able to support a child and a family. So, keeping in mind, as we kind of move through this webinar that, that we may face barriers in our work, and also, that was not quite the order I was intending. Also keeping in mind that, that there are strategies that we can apply to support fathers' participation in services. And so I'll get to that in just a second. I'm going to just go in the order that I've got my slides here. And I want to highlight a couple of resources for thinking specifically about the diversity of fathers and families and how to engage families in a way that is understanding and respectful of families' diversity. So one resource that I want to name for you, and as Judith said, we'll post these slides, you'll have the link, is the Diversity Informed Tenets for Work with Infants, Children, and Families. So this is a resource that I recommend checking out. I've got the tenets listed here, but if you go to the website, you can read more elaboration about what these tenets look like in practice and what it means to really bring these tenets into your work and have these ground and orient the work that you do. So you'll see things here like honoring diverse family structures, like supporting families in their preferred language, working to acknowledge privilege and combat discrimination. So I encourage you to check out the tenets and to see these as a resource for your work with families. I also want to highlight, and there's a link here to a really terrific report that came out in 2021 from the Harris Professional Development Network Fatherhood Engagement Committee, a really terrific concept paper on fatherhood. And I pulled here just a few of the recommendations that they make that speak to our topic today. So one of their recommendations for programs is to advance equity in parenting outreach and engagement by using more inclusive gender neutral terms, a broad diversity of caregiver images, and they elaborate just thinking about the many dimensions of diversity that you can bring to bear in your program materials and your programming in the work that you do. Another recommendation that they make is ensuring that fathers and services for fathers and male caregivers are respectful of and aligned with cultural values, principles, and practices of the population served. Programs should articulate an explicit commitment to eliminating gender, racial, and class bias. So, so again, here, thinking about getting to know the communities that you're working with and understanding the cultural values, principles, and practices that shape their parenting and their family lives. And then the third recommendation that I pulled is advocating for increased investment in evidence-informed, culturally competent co-parenting programs. So thinking about the importance of co-parenting and that programs be responsive to a variety of family structures and cultural norms and values. So another resource that I encourage you to check out. So I wanted to just move briefly to talking about a few strategies, and then I'm going to turn it over to my colleague, Daryl Davidson, who's going to go next. A piece of this work, I think, is thinking about preparation and training. So thinking about if you're working, in a particular community context, what you need to know and your staff needs to know about the communities that you're serving and bringing in the training and preparation that you need. Learning about what fathers are looking for and tailoring your programming to meet and be responsive to those needs. Thinking about specific barriers that fathers might face to participation and how you can support them in overcoming those barriers and making programming accessible. Connection with other fathers is often something that fathers are looking for. And so thinking about in your services, are there ways that you are bringing fathers together to exchange support? Recognizing that it's really important to consider who's doing the outreach and who's providing the services, or fathers seeing that there are, males on staff or a male alumni of the program. Is there something that signals that this program is meant for me and I'm not, stepping into a program that calls itself a parenting program, but really seems to primarily serve mothers and be staffed by women, and where I might be unsure of my fit or my place in the program. And then another thing is to think about support and referrals to quality, culturally sensitive community resources. So, being attentive if you're making referrals that you're sending people to organizations that are going to really be responsive to their needs. So with all of that in mind, I am going to now turn it over to Daryl Davidson, who's going to share, based on his work with the Milwaukee Fatherhood Initiative, what some of this looks like in practice. Thanks, Daryl.
Thank you very much, Tova, and welcome everyone. We really appreciate you being here, and we look forward to the questions that you'll be sending to us as we progress. I'm going to introduce who we are as the Milwaukee Fatherhood Initiative, which is a collaborative effort. It started between the City of Milwaukee mayor, and it exists that way today. We have a fiscal relationship with the Wisconsin Community Services Incorporated, formerly Wisconsin Correctional Services, and that has a very interesting strategic benefit because we're able to access now fathers from extremely different backgrounds as well as in various circumstances, and the diversity that we're encountering is almost indescribable. There's numerous partner organizations that we've been working with for close to 20 years now that assist fathers. They're prioritizing fathers that may not have necessarily been in their mission statement, but ultimately, if within the context of the organization's goal, they were trying to make sure that children thrive, we wanted to approach them as partners. So the core belief is that there's a positive relationship between the children and the fathers based on the involvement of the fathers, because that's what strengthens children, families, and communities. Why don't we go to the next slide? So what we are, we're a hub, not only in practice, but now we are a physical hub. We have a building that indicates that we're collaborating with efforts designed to help fathers. And some of these seamless access to the supportive services in our facility include child support services, which comes through the Milwaukee Fatherhood Fire supported program, offender reentry services, which is related to Wisconsin Community Services, workforce development, employee consultation, which is through multiple partners who have the skills in developing jobs and giving proper direction and guidance on how people can develop goals and follow through with those goals. We also have permanent supporting housing, which comes from our relationship with our local housing authority, energy assistance programming, behavioral health services, and child development screening, which has always been a part of the Milwaukee Fatherhood Initiative. Something else that's not listed on the slide, we have a strong relationship with our public school system. There's an entity known as the parent coordinators, and through that office, we work with them. They facilitate activities between parents, between teachers. They also work with the parenting teens or parenting students. And so we have a relationship with them, as well as the relationship with the fathers of the pregnant girls who are in these facilities. We have many services delivered at multiple sites now. So at our WCS contact sites, at our main Milwaukee Fatherhood Initiative site, and also we are conducting classes and coordination of services in schools now. So we're serving multiple services with many different types of students who are coming from various backgrounds. So this includes backgrounds where there may be class differences, immunization issues. We have students who are coming from areas where they initially began with language barriers. And we also are coming in contact with many individuals who have particular thoughts about parenting or fatherhood based on what they may have learned, but they may be trying to change that and they want to be more engaged than the previous generation. Next slide. So the manner in which we made this happen, we had to develop a diverse support network that empowered the fathers. And in doing so, it's just like recruiting individual clients. We had to recruit organizations that were going to support us as referral resources. And then we also met with those organizations and tried to establish that all of us as a group were going to maintain an open door to diverse fathers in varying circumstances. So if there's a partner organization that is not comfortable or doesn't have the skills or the training to work with a particular subset of fathers, that could be the group that we may need to encourage home visiting, or the group that might need the translator interpreters. Those are the ones that we are working with and we are talking to make sure that the needs are met for not only the organizations, but it's the proper placement of the father at the individual organization. We establish referral partners that prioritize where the fathers need support. So this could be youth serving. This could be public health. And if the fathers need health services, we work with our federally qualified health centers if there's any issues around the cost. There's legal services abound. So that can include people who may be referred to us through the court system. We also are working with individuals who are coming to us with many questions around family court. We have a good relationship with multiple legal entities, and many of them are no cost. One of them is the Milwaukee Justice Center, which assists us in identifying appropriate candidates who might be eligible for expungement if they were involved in any type of negative activity that now has followed them for years. If it occurred before a certain age, they may be able to assist them. Of course, there's varying social service activity, and that can include credit repair, that can include placement in temporary or even permanent housing, and also assistance with what may happen if the person is out of a job, something that can then assist with establishing some type of financial assistance for them. So the providers work with us to build a comprehensive network, and that's what strengthens the fathers. And we are telling the fathers regularly that these services are available, and we are asking the fathers to help us guide them to what they need. So it's not a matter of saying this particular referral resource is what you have to take a look at. We give options. Also, when promoting employment and educational opportunities, we are making sure that these educational opportunities and these employment opportunities do have a father-focused element to them. So we're looking for father-friendly workplaces. We're looking for people and organizations that if they don't have it in their mission statement, we take a look at the environment. If the environment is set up where it has images of families or images of fathers and has literature for the fathers, or if we need to provide that literature for that that office or that waiting room, we're happy to do so. We have a good relationship also with maternal and child health programs, because at varying ages, these programs are going to make sure that they have a relationship with the fathers, no matter what it is, even if fathers are the non-custodial dads, or they may be fathers who are just getting to know their children, even after 4 or 5 years, and the families of the child from the mother's side wants to reestablish a connection with the father. We're there for that too. So we talk to those dads, and in this case, the moms, about building trusting relationships and showing the fathers that they are not only valued, but they're needed and they're respected. So we do operate and allow the fathers to tell us in their assessments what are the boundaries of a particular culture or in their life circumstance, how far they want to go with a relationship that may be a past relationship that they're not involved in right now, but we are concerned about what's the relationship with the fathers and the children, and we keep promoting that. Let's go to the next slide. And so that's the reason why the fathers are the ones who co-lead these conversations. We have multiple sessions, and they have a different look. Some of them are held in barbershops where we're calling it Real Men, Real Talk. And in those, we are demonstrating that we can have the fathers lead those conversations. So they are the ones who are assisting us with delivering the surveys and also developing what the conversation and the discussions are going to be about during those evenings. And then we have other events that take place, such as the one tomorrow at our facility, where we are the ones who are designing what the conversation is going to be about, so that the fathers can begin to think about some life circumstances that they may have conquered, but because they've conquered them, they don't necessarily see them as a challenge and may not relate to other people perceiving them as a challenge. So that's when we get into the conversation about having the fathers not only talk about how they were able to overcome challenges, but also we discuss systems and how to navigate them and what they believe are appropriate in their circumstances, solutions that we can help them and inform them on. Remember, this is what we do because the fathers are the ones who are leading our discussion in most cases. We get their advice and their guidance too. As they express to us, they are the ones who have developed this, and we are the ones who are facilitating it. So to make sure that we have a father-friendly environment, we ask these questions. Are there messages in your offices or in your environment that are reflective and reinforcing fathers and what fathers believe in or what fathers prioritize? And has your organization assessed the attitude of inclusion of fathers in your program? So once again, we can go back to in your mission statement or in something that may be outside of your routines. Are your staff aware that fathers are valued? Is that the culture? Do you have trainings in place to support and empower father engagement? And if you do not, do you know how to access them? Do you have numbers or names or websites where even if you have to do it remotely, you can participate in father engagement training? Is your agency or program ready to engage fathers as partners in its work? So in other words, the manner in which we're doing it, we're bringing in fathers who are functioning as an advisory team, and we have the advisors introduce topics to us that we may not have necessarily thought about, or even they discuss what they might have seen at our Real Men, Real Talk sessions and will identify something that perhaps we need to explore. So are we including these fathers on our advisory committees and focus groups? And when we are doing that, are these fathers diverse? Are we picking fathers that we're comfortable speaking to all the time? Or are we talking to fathers who sometimes they might rub us the wrong way, or they seem very enthusiastic, but at the same time, it doesn't really match all the time what we're thinking about is the appropriate way a fatherhood program should go, but maybe they are going in the right direction and we need to be open to their suggestions. Do we also have policies in place to support father engagement and involvement and partnerships? So we want to make sure that those practices, and they don't necessarily have to look the same at each individual agency. What we want to do is include those fathers in the discussion and ensure that we do follow up to make sure that the fathers are getting what they need in those discussions. So if we don't have the infrastructure, can we partner with organizations that do and then make arrangements to work closer together so that the inclusion is considered right at the beginning? So Tova, you can go to.
Thanks so
Dr.
much,
Thomas.
Daryl. Yeah,
Yes.
we are going to transition to Alvin Thomas now. Thanks, Daryl and Alvin. Turning it over to you.
Great. Thank you very much, Tova. And thank you, IRP, for this opportunity to share with you some of the work that we've been doing and which kind of dovetails really nicely with the work that Daryl and Tova and many others are doing with regard to fathers. So at the eve of Juneteenth, 2022, and the intersection with Father's Day of that same year, we launched the Black Fatherhood podcast. And the idea behind the Black Fatherhood podcast is 3 words. Well, it's actually 1 word that makes up 3 words. It's EVE, Eve. And so we thought it's the eve of concern or greater concern or increased awareness of the struggles, but also the successes of Black fathers in America and beyond. And the EVE stands for educating, validating, and elevating. That's educating, validating, and elevating Black fathers. And the idea is to grapple with the current perceptions of Black fathers, negative perceptions, pernicious, historical, stereotypical perceptions of Black fathers and their roles in families, and to join the fray in both controlling that narrative and changing and rewriting that narrative so that the full reality of Black fathers becomes evident. So the idea behind the podcast was essentially to also translate a lot of the literature. So some of the work that Tova has done and other researchers have done gets reflected in the podcast. And we wanted to make it to make it such that it would be both palatable and accessible to the ordinary father, but also to researchers and to policymakers and to community practitioners and to other kinds of providers, from teachers to early childcare providers to therapists, any individual who happens to work with families and work with fathers specifically, we assumed would be able to benefit from some translation of the research into common everyday conversation. We hoped it would also become a resource. So I did therapy for quite a number of years, specifically with families and very often with Black and underrepresented families. And very often I would find free community resources that individuals could use as a subsidization of the therapy that they were getting with me. And I thought of how we could make this podcast a very similar thing. And so you'll notice that on here, we have a number of different platforms that the podcast currently lives on. If you scan that Scan Me QR code, it will take you to the lab website. It will take you to our Instagram page, our Twitter page, and to the anchor spot for the podcast. And I tell you that so that you could actually try to scan it now, because what we hope will also happen is that if you know of a person or you are a person who you think would be really great to add a voice to this podcast or can add something unique and interesting and useful to this podcast, feel free to use any of those spaces to leave that feedback for us. Send us an email or something, or send us something on Twitter or on Instagram saying, hey, I know this person, or let me connect you with this person who might be great to add to your podcast, and we will definitely take a look at it and feel how we could fit them into the next 2 seasons of the podcast that's being currently considered now. If you could advance the slides, thanks, Tova. So who is listening? Remarkably, towards the beginning of the podcast, we're releasing 2 podcasts every week, and we had about 75% men. And this was like about maybe generally the ages of 22 to 45. So a lot of men were listening. I'm not sure if we necessarily had a breakdown race, but we knew a lot of men were following and listening to the podcast. And then the season kind of went through and we weren't posting any new podcasts. And then we saw a jump in the number of women who were listening to the podcast, where now we have, I think, about 89% women listening to the podcast versus men. And so I think what that tells us is what we found in a different study, that men often would argue that with regard to finding services and finding resources in the community, often they have lots of difficulty finding those resources. And when they finally find a resource that really connects to them, they jump in fully ready to engage. And then suddenly months after or years after, that resource disappears and they feel like they were left all alone all over again. And so we saw that playing out even with the podcast, that for about 5 or 6 months, the podcast was up and running and was providing really good resources for men. And then we weren't providing new episodes every week. And so eventually the guys kind of left. And so what we're hoping is that in the second and third seasons, we have about 44 episodes that we have planned out, that we're planning out. That'll be rolled out over 2 years, and that will give fathers enough opportunity to connect and have some kind of continuity to the resources. So as you're thinking of the kinds of resources that you're making available or that you have available for fathers, think about the continuity of those resources. Any break in continuity usually causes some flustering with regard to the level of trust or the level of reliance that fathers feel that they can have on resources. So again, being very careful about that. You're right, Tova. Advance to the next slide. So with regard to which episodes are the most popular? Currently, the most popular one is Behind the Scenes, where myself and my graduate student, Eric Crawford, who helped with pulling this project together, sit back and talk about the usefulness of the podcast and what we want to see the podcast being able to do going forward. So Richard, the other episodes of the podcast are specifically researchers, community members, and community partners from around the country who are coming in and providing historical lens on what fatherhood looks like and giving us a really good grasp, both statistically and research-wise, about what fathers' stories have been and continue to be. And then that episode with Eric and myself, we spend some time kind of processing and debriefing the experience of creating these episodes and the experience of having run through these episodes and the stories, the deep stories that we hear from fathers, talking about some of the reflections that we get from the listeners to the podcast. We had one woman from a small town, I won't mention the small town because you know exactly who she is, in Wisconsin, well, somewhere around Bayfield, I'll put it that way, who talked about how even as a white woman, she saw herself and saw her father's story in the podcast. Even though her father was not a Black man and she was not a Black person, she saw the common humanity that existed in the stories of these fathers. One of the most iconic episodes across the podcast, or two of them, are one, the meaning of fatherhood, where we have a number of fathers come in this podcast and talk about their specific stories, their challenges through fatherhood, and what it means to be a father. And then for the other one, we had man, parent, Black, that intersecting identity, having professionals and fathers, professionals who are also fathers, to talk about how it feels to try to undo that tri-folded braid of identity, the identity of being a man in America, the identity of being Black in America, and the identity of taking up that fathering role, and how individually the weight of each of these identities, but collectively the intersecting and intricacy of those three identities and what it means for the lives of Black fathers. If you could advance to the next slide, Tova. Thanks. Beyond this, we wanted to kind of get a feel for the reach. So we were really excited when FeedSpot reached out to us and said, hey, at one point in time, we were number 6 And again, because we did not continue with multiple episodes over the last year, we kind of fell down to number 15, which is still pretty good when you think of the number of podcasts that are out there. And so what it's telling us is that there is a space for this work, that the story of Black fathers needs to be told. The narrative around Black fatherhood needs to be rewritten by Black fathers themselves, and by Black women, and by Black families themselves. If you could advance to the next slide. And so we think of the Black Fatherhood podcast as a resource for fathers. So when fathers cannot find resources in their community, fathers may be able to come together, whether it be in person or virtually, and say, hey guys, let's listen to this episode on what a Black father is, and listen to what these people are saying, and then come back and talk about where we see ourselves in these stories, or what additional do we need to add to these stories from our own experiences. So fathers can use the Black Fatherhood podcast as a resource for themselves. Other organizations can use the Black Fatherhood podcast to kind of be able to do some of that deep level analysis that Dara was talking about, thinking about where we are with regard to how we want to engage fathers. Great desire, but are we actually moving towards the desire? Do we actually have the knowledge to be able to move from desire to actual fulfillment of that desire? And you may be able to find some support for that through the Black Fatherhood podcast. I'm hoping that we'll have some time towards the end of the presentation to talk a little bit about other ways that policymakers, researchers might find sustenance from the Black Fatherhood podcast, and think of different ways to expand the stories of Black fathers and to elucidate the lives of Black families.
Thank you so much, Alvin. Christina, we're going to turn to you next.
Hi, everyone. Thank you so much. I really am honored to be on this panel. It's quite some folks to follow, but I will do my best. I am offering kind of the point of view for Latino dads. And so I wanted to give you all some background. Hispanics, we currently make up the largest ethnic and racial minority in the US. And Latino children are making up 1 in 4 children in the US. And we're projected to reach 1 in 3, similar to non-Hispanic white children in the future. Again, Hispanics are a huge group. And so under the large umbrella of Hispanics, the 3 largest subgroups are Mexican American, followed by Puerto Rican, followed by Cuban Americans. And so depending on the communities you live in, you may be working with some kind of very different and diverse Hispanic Latino fathers. We disproportionately experience higher rates of poverty, unemployment, and segregation. 1/3 of all Hispanic children in the United States are in poverty more than any other racial or ethnic group. The majority of Hispanic fathers are living with all their children, 73%, and with their partner, 82%. And few have fathered children with more than 1 woman, and most are employed. Around 90% of the dads are employed, yet most are low income. Most Hispanic fathers, around 64%, are immigrants, and half are Spanish dominant speakers. Next slide. So I know a lot of the folks joining us today are from Wisconsin, which is not where I'm coming from. So I wanted to give just a quick background. I won't read all of these points, but Latinos are the 2nd largest and fastest growing minority and racial ethnic population in Wisconsin. And it's growing and booming. 2/3 of Wisconsin Hispanic and Latino population is concentrated in Milwaukee, Dane, Racine, Kenosha, and Brown counties. And the Latino population in Wisconsin is relatively young, around 25 years of age, compared to 38 for your state's population. I won't read the rest of those stats, so we can move on to the next one. So how are Latino fathers involved in their children's lives? We know that compared to white dads, Latino fathers are more involved in physical play, things like peekaboo, wrestling, more kind of hands-on physical play, and encourage more risk-taking than the moms, and tend to use higher quality language in interactions with their children than Latino moms. We also know that Latino dads can buffer some of these negative effects of maternal depression that may occur and cause infant distress in young children. Latino mothers are reporting that their children's fathers are highly engaged. They're accessible, they're responsible, they're involved with their children's lives, they're doing caregiving, discipline, they're involved in certain decision-making activities. So a lot of folks on this panel have talked about the importance of fatherhood identity. And that it's an important kind of idea or construct that we know can hold a kind of a turning point for Latino dads, that holding the idea that they're a father can be very important to their overall identity. So you might identify as a son, as a student, or as an employee, but the fact that you're a father can help kind of create a barrier from maybe negative experiences that have been happening in the past. So we know some like new dads might be considering a break from maybe substance use or gang involvement or other negative behaviors because they're a father. And so stressing the importance of being a father, of identifying as a father, can offer a lot of benefit. Let's see, next slide. Okay, so I wanted to talk quickly about some important cultural values for Latinos and Latino families. We know that the family, or familismo, is an important cultural value for Latino fathers, that feelings of loyalty, solidarity, and the family as an extension of itself are extremely important. If a few research studies have shown that Mexican American fathers who hold high family values, or that they are highly invested, report being more involved in interacting or monitoring of their kids or in their children, rather than fathers that have low values in this domain. Latino mothers and fathers who kind of highly believe in this cultural value of familismo have better outcomes for their children overall, and better psychosocial functioning, and they have fewer depressive symptoms themselves, and their kids are involved more in their kids' schooling. So I wanted to talk briefly about machismo, and it often gets a bad rap in the Latino community. And so there is kind of this kind of traditional machismo, which can often be given more kind of a maleness, masculinity, kind of stereotypical viewpoints. But there's this other kind of domain, which we consider called caballerismo, which emphasizes this idea of being a provider, that you are trustworthy, that you have courage and humility. And fathers who hold this kind of less kind of traditional gender roles are more involved in aspects of parenting, like supervising their kids or monitoring what their children are doing. And so I think kind of seeing machismo as kind of like a broad view will often benefit fathers. And the last piece is this idea of respect, which often can kind of color the parenting activities for fathers. The work that I've done has shown that, even though respeto in Latino families is felt that fathers feel that it's very important that they are respected in the family, that it is actually very much a bi-directional relationship, meaning that it's not only they feel that they need to respect from their children, but that they also respect their child. And so this is a quote from one of our father participants. It's translated to "age does not matter, because for that word respect, age does not exist, because an adult must not disrespect a child, nor a child to an adult." And we heard lots of stories from our Latino dads talking about, not maybe disciplining in public, that they might take the child, to a different location and talk about the behavior rather than disrespecting their child in public. But that, that this idea of respect is both bi-directional, from the father to the child and the child to the father. Okay, next slide. These are some quotes that we heard from dads. The one underneath the picture says, I think the key in everything is talk to me, I listen, I talk to you, you listen. That they're highly engaged with their children. They want to play with their kids. They want to learn about their kids' interests and their abilities. And that they feel often disregarded in a lot of service provision. This one father says, when I'm going to the school or I've gone to some community agencies or whatever, I'm with mom. So everything is pointed to mom. And I'm like, I'm here. I know everything about my son. I know how to answer any questions. I take my kids to the doctors. I do everything with my kids, just like mom does. But everything in society is towards mom. So I know you're all on this webinar to hear how to engage kind of dads a little bit more. So I'll give you the next slide, which, yep, thanks. How to better recruit fathers into your programming. And this is from the little tag at the bottom, says National Fatherhood Initiative. And they offer a lot of great tips. So we've used maximizing word of mouth marketing. We've asked Latino dads to go out and bring a friend back that would fit, be a Latino dad that would want to be involved in some of the programs we have to offer. We've offered incentives for doing that, for, a gift card. And so forth. We've asked community partners that like Head Start or Early Head Start or other social service agencies or schools to refer fathers that might want to come and be involved in our programming. We've gone out to where dads are. So that might be different in every community, sports arenas, community centers, sporting goods stores, repair shops, places where you can find dads that might be interested in your program and recruit them. We think it's really important. It's worked really well for us to staff programs with men as facilitators. A lot of times they are graduates of our programs and want to come back and help facilitate. Oop. Could you go back? Sorry. And we also are asking for referrals on special, important, issues, and we'll offer things like legal assistance for fathers. You want to provide incentives that are valuable to the dads, and that depends on your dads. Sometimes we found offering them diapers, and that's a great bartering tool for their for the moms or their partners. We've offered gift cards for activities with their kids. They really like that. Movies, taking them out to mini golf, whatever's around in the community. Okay, next slide. So again, just tailoring interventions to include the dads, figuring out what motivates them and engages them. We found that, if they come to the first 3 sessions of our programming, they're likely to stay. And so we've offered heightened incentives to come to the first 3 sessions. And we've really kind of built up fatherhood as their identity within the programming to stress that piece, and then also to stress cultural values that are important to Latino dads, the importance of the family, the importance of being a provider, having courage, humility, and having respect for and to their children. And then finally, I know we want to get to questions, so I will go to the next slide to just let you know I am the editor-in-chief of Families in Society, which is a journal and social work, and we have put together a small collection of articles that focus on fathers and child and family services. I can put the link in the chat as well, and we are opening up these articles for the month of March so you can read them, because I know sometimes there's a paywall barrier for folks. That's my 10 minutes.
Well done. I kept it perfectly to 10 minutes. So I'm going to stop. Actually, I'm going to stop sharing my screen now, and we are going to move into discussion mode, but I'm going to just name for you a couple of things that are in the slides that will get sent out to you, since I saw some questions coming in about sharing photos or links that went by really quickly. So I want to let you know we're going to email you the slides afterward, and they will include, all of the links. Many of the pictures in this presentation can be found through a really wonderful resource, the Diversity of Fatherhood Photo Bank. I put a link in the Q&A. It's also in the slides. And so just want you to know that is coming your way if there was something that you're wondering where to find. Contact information for all of the presenters is also in the slides. So if there is a specific question you wanted to ask that we don't get to today, you're welcome to reach out to us afterward. And with all of that said, we're going to turn to some of your questions. I want to start with, there's a question that came in a couple of times through the Q&A box. So you may have seen it, my fellow panelists, but questions about thinking about gender and inclusion and the right language to use and how to be inclusive in groups for fathers. So I'm going to share a couple thoughts, and then I want to open it up to you all to hear what you think. I shared one recommendation from that Harris Foundation report where they suggested using gender neutral terms. And I want to say that I'm actually not sure I agree with that recommendation for a particular reason, which is that in some of the work that I do with fathers, I hear that it's really important to them to hear the word father said out loud and named, or they don't know if it's for them, that they've had enough experience of, going to a parenting group or being told it's for parents and being the only dad in the room and feeling like, actually, maybe I'm not really meant to be here. So I think it can be important to name if a program is intended to include dads, to name that explicitly. My own thoughts, there was a question that came in about, thinking about trans parents and welcoming them into fatherhood groups. I think fathers are those who I identify as fathers. So I think about this in terms of biological fathers as stepfathers, that grandfathers who are raising their children and playing a fathering role. If I was leading a fathering group and someone of any gender, of any biological or not biological relationship, whatever the dynamics of that relationship, somebody who identifies as a father and is playing a fathering role in the life of a child, want to support their fathering, want to support their father-child relationship. So that's kind of how I think about that question. But I would love to hear, from others on the panel, do you think differently about that? How you think about this question of naming fathers, of defining fathers, of being inclusive in programming?
Thank you, Tova. I'd like to start off by saying much of what you were saying, I do concur. I also believe that much of what we're doing is about promoting the images of fathers too, which we haven't done as often as we probably needed to in the past. So it didn't matter necessarily about the age or even the race or the class, or even in this case, when we were talking about maybe a transgender situation. What we want to do is promote that the word father is what we're leading with. And so, because I don't believe my organization is changing its name, but we do want to show that there's a broad spectrum of what's representative of the father in various types of families. So yes, if it's an uncle, or if it's the grandfather, if it's the stepfather, if it's the person who is the most influential figure for that child who's identifying themselves as a father, we want them to talk to us. We want to work with that individual.
Thanks. So another question that came in, I guess I'll just keep us moving because we have so many wonderful questions that I want to get to, is about engaging fathers specifically in the context of child welfare. I'm wondering if folks have advice for thinking about how to include fathers. I can look to the specific language of the question, but we got several as part of registration, and one that came in just now asking about, asking in child welfare, foster care, kinship care context, how speakers would recommend ensuring that dads are equally involved in co-parenting and decision-making. Thoughts from anyone on the panel about that? Would anyone like to take the first pass at this one? I think one thing that I would say is I would just offer a couple of examples of places that are making change that you might want to look to. So Los Angeles County in particular is doing some really innovative things in expanding engagement of fathers in child welfare. First of all, they've really revamped all their forms. So, in many places, you don't necessarily have to list a father's, information on your intake forms. And so already you're starting kind of behind the curve with engaging fathers if you're not thinking about fathers from the get-go. So they've kind of done a careful audit of where are all the places kind of procedurally where we can really make it happen that fathers are very front of mind. They are also part of a project with in partnership with Mathematica and some other child welfare agencies, looking at ways of really expanding engagement of fathers in child welfare. I'll find that in just a second and put a link in the chat, but some of you might be interested to read about that project and look at some of the examples of how different child welfare agencies are trying to make change in that domain. But I would say a starting place is just thinking about where are all the places that we are bringing people together, thinking about who's a stakeholder, and are we making sure that dads are included and not secondary? Are we thinking about paternal relatives as resources and making sure that, they're front of mind too, if we're thinking about placement options along with maternal relatives to kind of maximize, bringing to the table everyone who cares about and has a connection to the child.
Yeah,
Okay.
I put
Yeah,
in
please
some
proceed.
links. I put in some links for the Child
Great.
Welfare Information Gateway. They have Engaging Fathers, and like lots of resources there. The other link is for Effectively Engaging Fathers of Color. They have some videos. They have a discussion guide that they posted that has a lot of different resources. So those, I think, 2 websites will get people started.
Yeah, thank you for adding those. And thank you to the participants who've added a few other really terrific resources. I can see some great ideas and links showing up in the chat. So one question that came in was thinking about, the terrible disparities that we have in the state of Wisconsin in maternal and child health, and thinking about infant mortality, and thinking about where do fathers fit into our efforts to close some of those gaps. I think I'll turn to you with that one, Alvin, if you maybe want to name some of the work that we've been doing in Milwaukee, thinking about how fathers are a part of the puzzle and thinking about that pernicious problem.
So I think thank you very much, Tova. We're still in a space that reflects a lot of the historical views that we had of fatherhood and of parenting, where at one point in time it was almost impossible for a father to be in the delivery room, and now it's being seen as something that's a little bit more acceptable and almost expected. But in other areas, we still have those same old values, those same old belief systems with regard to where fathers should and should not be. And I think in maternal and infant health spaces, whether we say it or not, there's the implicit assumption, the default assumption, that if we're talking about mother's health and baby's health, that's the mother's space. And the father can do other things, but he can't be in that space. And so last year, myself and Tova, and we connected with the African American Breastfeeding Network in Milwaukee and did a really great study with them, and connected with, that's kind of how I've connected with Daryl Davidson, and the rest is history. But connected with these organizations in Milwaukee, specifically the African American Breastfeeding Network, to hear the stories of Black, new and expectant mothers and fathers. And essentially what we were hearing was, what we were finding from these studies was exactly what we knew all along, but we were able to now have tangible empirical support for the stories that we were hearing, that fathers were not being included in those spaces, but there was a very high level of excitement and desire to be included, both from the Black fathers and from their spouses. And that's whether they were married to the mother of their child or not. They were still interested in being involved, but our organizations had either gone through with their default of parent, meaning mom, or didn't quite know how to make that transition just yet, or weren't quite connecting with fathers. And so the stories of these fathers and mothers from Milwaukee was essentially letting us know a really good assessment of where we are with regard to including fathers in these spaces. And we know that there's still quite a bit of work to be done.
Thank you. Daryl, I wonder if you want to add anything. I know you partner with maternal and child health programs, and how you think about engaging fathers in that work.
Yes, thank you. So I'm very, very much a proponent of talking to maternal and child health programs before they see fathers, get the fathers involved in the prenatal discussions, get the fathers or the soon-to-be fathers involved in the prenatal discussions, get them involved in discussions around participating in breastfeeding and maintaining that process, have the discussions around plans for what takes place at the delivery and infant care after delivery. So those are the types of coursework that we deliver to our fathers when we talk to them about the relationship with children, but we also are letting the maternal and child health partners know that not only are we doing that, but we need a corresponding supportive effort from maternal and child health that's going to more or less match the type of information that we're saying, because it's not going to do the child any good if you have two completely different belief systems that exist either in a household or in a family environment if the two parents are not in the same household.
Thank you. So I know we're coming to the end of our time. I'm wondering, Judith or Dawn, if you might be able to post one more link in the chat. There are a couple of questions that have come in that I think some of the earlier webinars in this series speak to. So I wonder if we could post a link to the earlier webinars. A great question about thinking about making your environment father-friendly and other questions here that I think you might be interested to check out some of the earlier webinars.
Absolutely, we can do that. And we can also send that out in the
yeah.
email with the slides
Awesome.
and the recording.
Thank you. So I'm going to turn it back to Judith now. We're unfortunately at the end of our hour, but I'll remind you that our email addresses will go out with the slides and that we're happy to connect with you if some of you have questions that we didn't get to.
Great. Thank you, Tova. And I just want to say briefly, thanks so much to Dr. Tova Walsh, Mr. Daryl Davidson, Dr. Alvin Thomas, and Dr. Christina Mulgrew Wilson for sharing their time, their experience, and their research with us today. Very informative, clearly, very well received from the many positive comments in the chat. And so, as we did mention before, we will be posting the slides and the recording of the webinar within a day or so, and you'll receive a link to those by email. We'll also include a link to the Black Fatherhood podcast and to the other webinars. So it'll be a one-stop shop for all that great information. So thank you all for joining us today, and I hope you have a great rest of your day.